Hi everyone, my name is Leah Crown. I'm the Director of Health and Human Services for the City of Meriden. It is time for our weekly social media question and answer video. Many of the questions that were received I was able to answer by Facebook. Many people were looking for links to the governor's executive orders, the city updates, or information about drive-through testing sites in Meriden. So I did answer those directly, so please, if that was your question, please check the City of Meriden's Facebook page and the answers will be in the comments. So as always, thank you for your questions. As you are aware, and as I have noted on every single video, COVID-19 is a rapidly changing situation. We're learning new things every day. The guidance is changing through our phone calls with DPH and other community partners. We're learning best practices, and we are trying to relay that information to the community as quickly and efficiently as we can. Certainly, always, you're more than welcome to reach out to the local health department if you have any specific questions in between these video segments. So the answers to your questions today, and we received 11 questions, are based on current CDC guidance, as well as the current governor's executive orders that have been issued as of April 21st, 2020. So our first question is it safe to order takeout? So based on information about what we know about this novel coronavirus so far, it seems very unlikely that COVID-19 can be transmitted through food. To date, there have been no confirmed cases of this mode of transmission causing a case. But there are some precautions that you can take when ordering takeout. So if you order takeout and you're having it delivered to your home, if you can pay online or by phone ahead of time, that would be ideal. Please accept deliveries without in-person contact whenever possible. Ask for deliveries to be left in a safe spot outside of your house, such as a porch or lobby, with no person-to-person interaction. Otherwise, if you need to have that interaction, please stay at least 6 feet away from the delivery person. If you're going out to pick up your takeout, please wear a face covering when you go out to pick up your order. If possible, again, please try to pay ahead of time online or over the phone. And please stay outside the establishment until your order is ready. For both means, if you're picking up or getting delivered, please wash your hands before and after you eat and clean and disinfect any surface that your takeout order may have been on, such as your kitchen counter or table, or if you're like me, your coffee table in front of your television. Our second question, how many positive cases and deaths are there from patients in the nursing homes? Which nursing homes specifically? And the second part of that question, the other positive cases, are they from essential employees or people coming into contact with the virus going out? So starting last Thursday, April 16th, the state of Connecticut Department of Public Health started releasing nursing home specific data, and they will do so every Thursday. So this data is for nursing homes, specifically the case counts as well as the death counts per nursing home in Connecticut, as long as there has been at least one confirmed case in that nursing home. The web address every Thursday to look at this information, and it's usually posted between 4 and 6 p.m., is www.ct.gov/coronavirus. Look for the blue box that says test data in Connecticut and click on it, and a PDF document will come up with that information. So as I mentioned, data is per nursing home. As long as there is at least one case in that nursing home, it will be listed. On Thursday, April 16th, when the state put their first report out, as of April 14th, the Curtis home in Meriden did have 6 cases and sadly 1 fatality associated with COVID-19. Question number 3, what is the most common first symptom felt with COVID-19? So people with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. The symptoms generally happen anywhere from 2 to 14 days after exposure to the virus, and these have been the most common to date: fever, cough, and shortness of breath. That's what the CDC has really put out as the 3 things that you should be looking for. However, they just recently added the following symptoms: so chills, repeated shaking with chills, muscle pain, headache, sore throat, or new loss or taste of smell. Number 4, can you catch COVID-19 again? So the CDC and their partners are investigating to determine if you can get sick with COVID-19 more than once. At this time, we're not sure if you can become reinfected So until we do know more, please continue to take steps to protect yourselves and others. Number 5, how can we get access to our loved seniors living in nursing homes? So per Governor's Executive Order number 7, that was issued on March 12th, and a subsequent order from the Commissioner of the Connecticut Department of Public Health, there have been restrictions put on who can enter nursing homes in an effort to protect this very vulnerable population. So if you have a loved one in a nursing home, I would suggest reaching out to that home to see if there's a way to connect via online chatting such as Facebook. The nursing home may also have specific measures that they're taking to connect family with the loved ones to have other types of virtual visits. So I'm sorry that it's not more specific, but it might be different per nursing home, so it's best to reach out to that home to see how they can accommodate you without you actually having to go into the building. So number 6 was looking for an update on the Westfield convalescent home. So we did have a conversation. When I say we, it's me and the city manager, the mayor. We had a conversation with the Connecticut Department of Public Health yesterday on April 20th regarding the Westfield property. According to the Department of Public Health, it is scheduled to open tomorrow, Wednesday, April 22nd. This facility will be a site for those who no longer need acute care at a hospital, but still need some sort of convalescent care. This will free up the beds at our hospitals, and it's part of the statewide nursing home surge plan. Connecticut Department of Public Health did assure us on that phone call yesterday that prior to approval of the facility opening, the following assurances were put in place per a consent order that is available to the public: that they have adequate staffing, adequate PPE or personal protective equipment, they have enhanced infection control practices, and they are going to have regular communication with us as city officials. Initially, the Westfield property will take on 30 patients, and it has the max bed capacity of 120. Question number 7, what other symptoms do we look out for if you have a fever? So as previously mentioned, the other symptoms, the most common symptoms for COVID-19 that we have found and that the CDC reports is cough and that shortness of breath or difficulty breathing. The other symptoms that they recently added were chills, repeated shaking with chills, muscle pain, headache, sore throat, or new loss of taste or smell. Question number 8. What is the current criteria for qualifying for a COVID-19 test? And will antibody testing be conducted on Meriden residents? So the CDC does have guidance for who should be testing, and we do recognize that there is a shortage of tests for individuals, so they did come out with priority categories. Decisions about testing because you need a doctor's order are ultimately up to your physician. So the 3 priority levels for testing are, priority 1 is hospitalized patients and symptomatic healthcare workers. Priority 2 is patients in long-term care facilities with symptoms, patients 65 years of age and older with symptoms, patients with underlying conditions with symptoms, and first responders with symptoms. So priority 3 is critical infrastructure workers, again, who are showing symptoms, individuals who do not meet any category in priority 1 or priority 2 with symptoms, healthcare workers and first responders, and individuals with mild symptoms in community experiencing high COVID-19 hospitalizations. Those who have no symptoms are not in any priority list. This list that I just read is available on the CDC webpage. And as far as antibody testing, there are no plans right now to do antibody testing. The CDC and its partners are still doing some field testing to see how effective that test is. Why does, the 9th question, why does Midstate repeatedly run out of stock? So up until last week, we had a daily phone call every day with Midstate leadership. This week, it's going to twice a week. But as of our phone call yesterday, April 20th, Midstate does report that their supply of personal protective equipment, or PPE for short, is in good shape, and they're watching their supply chains very closely. They did report running low on disinfectant wipes, so I'm sure any donation of those would be greatly appreciated. Number 10, does the virus ever present as a severe upper gastric with low-grade fever? Also, fever persisting after gastric pass with no other symptoms. So we're still learning a lot about this virus. but results of a study published in the American Journal of Gastroenterology indicates that a subset of persons could develop symptoms such as vomiting and diarrhea along with abdominal pain during their early stages of infection with the virus that causes COVID-19. From our contact tracing of cases, we have found that a lot of clients are reporting diarrhea as one of their symptoms. If you have a specific medical concern, I would strongly recommend that you reach out to your doctor. Number 11, how can you tell the difference between seasonal allergies and COVID-19? It is the season for allergies. Everything's starting to get that nice yellow glaze over it. People with allergies often have itchy eyes, an itchy nose, and sneezing, as well as less specific allergy symptoms such as a runny or congested nose and a sore throat or cough that is generally due to postnasal drip. Symptoms of COVID-19 do include fever, cough, shortness of breath, and all of those other symptoms that are previously recognized. So if you have a specific concern, if you're not one that usually gets seasonal allergies and you come down with any symptoms related to COVID-19, we suggest that you contact your healthcare provider. So those are all of the questions that we received this week. Again, I appreciate the questions. I appreciate the outreach of support from our community. I do really recognize that this is a hard time for all of us, and we as a local health department can assure you that we are working 7 days a week to monitor the situation in our community. We continue daily. I field dozens of phone calls daily from strategic partners in the community, including police, fire, dispatch, the housing authority, residents, daycare facilities, to provide them with the updated guidance and to answer any questions that they have. We check in daily with our long-term care facilities and assisted living facilities and retirement communities just to ensure that they have enough PPE. So if we do happen to get a stock from the Department of Public Health or a donation, if we know that they need it, we want to get it out of this office as quickly as possible and into our hands of our wonderful healthcare providers that are taking care of those that are ill. So again, thank you. And if you have any further questions after this video, please reach out to your local health department. The phone number is 203-630-4226. Thank you.